Galimera, Galimera, Galimera. Good morning, good morning, good morning. How are we today? Well, as you can see today, it is definitely a grim day today here in Zakynthos. Just looking over the hills towards Amber Lockerbie and in the direction towards Keri. Yeah, we've got some right ominous looking clouds. It's just dull. You can probably hear it's also probably quite windy as well. So yeah, not a nice day. The hills are kind of, well, not too badly obscured, but from the looks of the high ground up there, it's definitely going to be a wet day at some point. The reason the broadcast is coming a little bit early, nice to see you looking in, Lyndon, at this time of the morning, is because Jane and I were off to the police station today to hopefully do the final part of the biometric card, where we have to give our fingerprints over. And then we're all done, and then all we got to do is just sit back and wait for the card to turn up. And how long that is going to be is anybody's guess. But anyway, this is the view over the back of the house, looking towards the area of Kalamaki and Lagana as the crow flies. Again, bit cloudy, no sun poking through at all at the moment. Hopefully it might do what it did yesterday, where it burnt the cloud off yesterday and we had a reasonably pleasant day. But I have a feeling today maybe not as nice. But anyway, that's a quick look. And looking over towards the direction of Sillaby. Yeah, again, looking a bit grim. You can probably hear the wind is blowing at the moment as well. There's the chickens, they're all out and about, running around, getting ready to make lots of noise. Got quite a bit of news this morning for you as well. Also as well, you've noticed that I've also put up some news from 2014 that I did while working for Hermes. And again, how things have changed and how things are still sometimes the same, all right, even from back in 2014. So have a listen to that if you've got a bit of time. But anyway, this is the news for today as to what's been going on. And I've got to be honest, it's not all good news as well. Right, so it's the 26th of January, it's Tuesday, it's day 83 of the lockdown. We did have earth tremors yesterday, and lots of different figures being bandied about, but the figure that I saw was it was 4 on the Richter scale, and that was from the Athens Institute, and that was yesterday afternoon, believe it or not. Yeah, but there's been no reports of any injury or anything like that. We're quite used to these earth tremors. I hate the way they use the word earthquake to make it sound really dramatic, when in fact, no, it's not really an earthquake, it's an earth tremor. An earthquake to me is when things start to fall down and big gaps appear in the middle of the road. Then you could say that's an earthquake. But anyway, we had one of those yesterday, and it was at 4 on the Richter scale, so it was a bit of a rumble, woohoo! Which sometimes we quite enjoy them, actually, to be honest. But anyway, looking at the COVID figures then in the last 24 hours, we've had 436 new infections across the country. That is up from the day before, where we had 334. Total amount of infections were 152,412 since coronavirus started. 20 of the new infections were actually identified after checks at the country's gateways. That is up on yesterday as well. That is where we had 4. One of these new confirmed cases we've had is here on the island. Yes, we've had another COVID infection here on the island. Now this time it's an 88-year-old woman. She's being treated at the Coronoclinic in the hospital. She went there yesterday suffering with mild symptoms. The old woman is also from Lithaki as well, and that's going to come up in further news as I go through. But at the moment, she is actually in the Coronoclinic, and this brings the total amount of incidents of coronavirus infection this year to 18. Yep, 18 positive cases we've had since the beginning of the year. Right, as for deaths, 25 new deaths across Greece, up from 24. That's making a total now of 5,671. The average age of people passing away from coronavirus is 79 years of age, and 95.4% of those have had underlying health conditions, all right? At the moment, just to bear in mind, the normal daily death rate in 2019, the average death rate was 329 people would pass away from other illnesses because COVID wasn't around then. But that's just putting it into context, all right? Also, as well, critical cases across Greece. They're down at the moment, which is good. Last time I reported, we had 292 people in critical cases. At the moment, the ICUs across Greece are now recording 286 critical cases. 3,330 of those are male, 2,316 of those are female. Now, the average age of people suffering in ICUs at the moment is 68 years of age, and 85 of those people have underlying health issues or are over the age of 70 years of age. And yesterday I did manage to retrieve that the Greek health authorities have just done short of 4 million tests since the start of the pandemic. They've done 3,034,059 tests. And they have also done 948,835 rapid antigen tests since the start of the pandemic. So when you consider that the population of Greece is about 10 million people, that's nearly half the population, or just short of half the population have been tested. Coming back to Zakynthos then, the classmates of the 10-year-old lad who on Saturday, together with his parents and his 9-day-old brother who tested positive for coronavirus, all his classmates have been put into preventive quarantine. Now, the pupils attended the primary school of Tragaki. All of the children who used the bus to school, together with the 10-year-old, were all put into quarantine, and that will probably be for 14 days, all right? The bus driver and the assistant to the bus driver who sees the kids and supervises the children on the bus, they were also placed into quarantine as well. Anyway, also a decision was made that they are suspending regular surgeries at the paediatric clinic, which is at the Zakynthos General Hospital. The two doctors who are involved with treating the mother and the baby, they've also been entered into 14-day quarantine as well, and nurses as well that also were treating the baby have also been put into 14 days preventative quarantine. So again, no news on the child at the moment in Rio. As far as everybody's aware, the child is okay, but no details, shall we say, on the condition of the child. I know people were asking that on the media, on the social media sites as well. Now, because Zakynthos has seen a rise of infections for a total of 18, with 12 of those infections just occurring last week, the Vice President of the Medical Association and head of the Infections Committee of Zakynthos Hospital, Dr. Markou, speaking to Hermes News yesterday, expressed his concerns mainly because we don't know where all these cases are coming from, and in most cases they are not related except for those concerning the family of the 9-year-old boy, where they were able to trace obviously within the family. Anyway, Dr. Markou said, so whereas Zakynthos was doing really well, according to the data and numbers we had at our disposal, it seems that things are changing alarmingly since last week. And within 24 hours, we had 6 positive cases, and 4 of them do not have any connection between them. Their distribution is random, geographically and age. So we do not identify a specific cause that caused them, such as a gathering or a house gathering. And this is because 4 of the last 6 incidents have nothing to do with each other, he said. Making his assessment, Dr. Markou noted, a first thought is that we have asymptomatic patients who transmit the disease, and that is why we have the above cases. Anyway, this worries us more because the asymptomatic ones can be anywhere and not easily to spot. Anyway, the latest incidents are mild, and let me tell you, he says, that in one of them, the person came to the hospital was because he suffered a fractured leg, and in the examination of his leg, he was then found to be positive. He also told us about small illnesses that he had in the last 2 to 3 days. The incident was found accidentally as the man had come into the hospital with his injured leg. Asked about the vaccine, Mr. Markou said that the number of people vaccinated is not such that it makes us worry about immunity of the population, while we must remind that in some people only the first dose has been given. It's too early to talk about immunity, which is achieved 8 days after the second dose of the vaccine. So we repeat the same in a strict way and ask for observance of the measures. Anyway, we are waiting until the results of the tracking of the contacts become known in order to see how far these incidents have reached. Now, he also says, I've talked to the mobile health unit to intensify tests. Many rapid tests have been performed on a random population in Zakynthos, over 2,500 at the moment, as the results were good. The dispersion was the lowest possible. Now the number of testing will increase to do many tests that will help us find something. Dr. Mark also concluded, we asked the people to respond to these tests. So he's actually asking for people to go and have tests, even though you may feel that you're okay, all right, and there's nothing wrong with you. Anyway, also speaking on Hermes News Radio yesterday, the commander of the Zakynthos Hospital, George Regulus, said now 60 people a day are being vaccinated now at the Zakynthos Hospital, and the hospital will continue to operate as a vaccination centre. Now, we were supposed to have had 2 vaccination centres. One was at the old Eka building in town, and the other was up in Katastari, up in the medical centre up there. But it looks at the moment the hospital is the place that is staying as the vaccination centre. Anyway, he also said as well, since last Friday, the vaccination platform was open, so people in the age group of 80 to 84 years of age, they are now being vaccinated at the hospital. Now, the island is now receiving vaccine twice a week. It is noted that the vaccine doses arrive on the island free of charge through regular air flights carried out, while transfer is undertaken by representatives of the Greek Armed Forces and the Security Forces and the General Secretariat of Civil Protection. We must remind the citizens, he says, that if they're registered in the intangible prescription system, where people have like a repeat prescription, they're already in the system, they will receive an automatic message, SMS message on their mobile phone, all right, to confirm an appointment. Anyway, the other way that people can, if you're in the age of 80 to 85 at the moment, is you can also call for an appointment by going onto the government site, elmuvulu.gov.gr. I'll put a little link up at the end of this broadcast, where you can enter your AMCA number and you can obviously make an appointment. But I think the easiest thing for older people to do is actually to go to your local pharmacist and see your pharmacist there and make an appointment through your pharmacy. They can do that for you, or you can actually go to KEP as well and get your appointment through KEP. It might be the easiest option rather than, I know a lot of people are daunted by the internet, especially at the age of between 80 and over. It might be better off seeing your, seeing your pharmacist, or going to KEP, all right, or get your family to do that for you. Right. And also, just to remind you as well, if any citizens have to cancel an appointment, they have to do so within 72 hours to cancel that appointment. And at the moment, the hospital is saying that they're actually vaccinating approximately 60 people a day. So again, at 60 people a day, that's going to take a while to vaccinate everybody. So it makes other age groups wonder, how long are we going to wait before we are offered the vaccine ourselves? Anyway, I'm still going to wait and see what happens, see how things proceed. I'm not in any rush at the moment to go and have the vaccine. Anyway, another news story this morning that was just breaking this morning in Greece. The UK is set to impose a mandatory 10-day quarantine on all arrivals from high-risk countries. At the moment, we are not a high-risk country, with the possibility of further countries being added to any list. Travellers, including UK residents, will be forced to stay for quarantine period in a hotel at their own expense. The British government is expected to confirm the new restrictions today. So I know that the internet was a buzz about these new measures that Boris was kind of surreptitiously pushing into the mainstream. It just makes things more difficult for us here today, for anybody trying to get back to the UK for, say, an emergency or something like that, with the thought of having to do quarantine before you can even get out of where you are to go deal with any issue that you may have back in the UK. So again, we're going to keep an eye on that story as well at the moment. Now, coming back to tourism again, here in Zakynthos, the president of the Laguna Hoteliers Association, and she's also the vice president of the tourism committee, Christina Tragaki. She's been speaking to the local press saying that the latest news from Britain is extremely unfortunate, as the British government is considering closing the border until cases are reduced. And on the other hand, the possibility that this decision will affect the summer period, depriving the British of the opportunity of their holidays. Anyway, what is needed is a common policy on health, she says, health protocols. She's obviously a big advocate of the health certificate. In the face of all these developments, the tourist entrepreneurs of our island are maintaining a waiting attitude and believe that 2021 will not be much different from the previous year. Anyway, Ms. Tragaki emphasised that this season will not be much different from 2020, and this means that the support of the industry with liquidity is necessary for the future. So obviously more bailouts for the hoteliers. Anyway, based on results of the latest research of the FDI and the Tourism Institute, Ms. Tragaki noted that 2021 starts with great difficulties for hotels, as it has been preceded by unprecedented crisis of last year. You might remember a lot of hotels last year, apart from not getting booked out, also didn't get paid by TUI as well. Anyway, in the fact, he underlined that this crisis concerns all the tourism sectors without exception, as well as the destinations, and the research shows there is no difference between an island that accepts mass tourism compared to another that has less to do with this model. So again, this is obviously going to affect us in a big way, but it also is going to affect other areas that also still have a tourist element. So they're obviously going to have a hard time of it as well. Now, everything, she says, is now determined not by the tourist agents and our customers, but by the infectious diseases specialists. Now we are guided only by the factor that concerns health, noted Ms. Tragaki, who was in favour of the existence of the vaccination certificate for travel, but mainly in the establishment of a common policy for the management of health protocols such as pre-test trips. Now, I think pre-test trips and certificates are good as long as they're not mandatorily enforced upon people. It still should be your choice as to whether you get injected in your body. However, no objection to testing, but the problem there is who's going to pay for the testing? When you start looking at the cost of holidays and then the cost of testing going on top, it can actually put the cost of your holiday up to quite a significant amount. So what I'm hoping is that some form of free testing might be available for people to get a free test to have done, to say, yes, we've been tested within the last 72 hours or whatever, and still be allowed to travel. Again, costs now are really going to rack up in the tourism sector. Great getting a cheap holiday, but then when your tests cost you more, or your vaccines costing you more than your holiday, then I think people will not be taking the holiday, or will be difficult for people to take the holiday as well. Anyway, she noted, I do not hide from you that we see the first 6 months of 2021 to be almost non-existent, and this is reflected in the reactions of tour operators who see 2020 to last 18 months. For our part, we are ready to operate as we did last year. On the same wavelength, the president of the Federation of Rented Rooms, Andreas Katonis, he also, speaking on Hermes yesterday, stressed that bookings remain frozen and there is hope for an improvement of the image as the vaccine progresses. Anyway, we are waiting to see what will happen with the vaccination, but also what will eventually apply to relations to travel. Mr. Conscientious also emphasised that at the moment the plans are made on paper. What we need is to pay attention to the issue of public health. It all depends on that. He noted, predicting that safer picture can be given from March and not earlier. So again, looking towards March now for some emphasis as to what will happen and how will the season proceed. Anyway, and finally, an interesting story here as well. More information is coming to light about the huge quantities of explosive that were found stored in an abandoned house in Keri. Police have been investigating this in the last few days, feels that this explosives purchase is the tip of an iceberg of a more important case. Anyway, on the packages containing 800 kilos of explosive, there was evidence of the origin of the material, but also for a specific batch that was found in Zakynthos. Now, the house in which the quantity of explosives was found was a building in the Upper Lati area in Keri that suffered serious damage in September 2019 during the fires. Anyway, the house has been completely abandoned, and the house belongs actually to a German national. Now, this German national has been dead for a few years. Even his relatives have not set foot on the island. So the people placing the explosives there probably were aware of that. Now, police believe that the September 2019, the explosives could not have been in the basement in the house before the big fire, which was in 2019. Another fact is that those who placed them there knew that the house was abandoned, and it would be very difficult for someone with no reason to go to that location. Anyway, the residents now of the village are a bit upset, as they would be, one because of all that explosives sat there, but they're wondering if there may be a fellow villager who's been involved in this case. Anyway, the large quantities of explosives could be used for work in the quarries on the island, but there's no such theft being reported of any explosive going missing. The other scenario that the police are considering at the moment is that the explosive could be used for illegal fishing. That's a heck of a lot of fish with 800 kilos. That's all I'm going to say. Anyway, so there you go. That is what's happening with the explosives in Keri. Right, okay, let's have a quick look and see who's tuning in at the moment and see how people are. Lyndon is watching. Nice to see you, Lyndon. Myra O'Connell is also watching. Nice to have you tuning in, Myra. Are you in Ireland at the moment? Just a quick ask. Mike Gattendy is around the corner. He's also tuning in as well. Nice to see you looking in, Mike. David Lowry is also watching as well. Nice to have you. Thomas Ganzer from Austria is also tuning in. I was really chuffed yesterday, Thomas. We had Sunny Flelger from Opus tuning in, also from Austria yesterday. So nice to see you there, Tom, looking in. Tommy Winston Burns is also looking in. Raff Reg, buddy, nice to see you. Baz Horworth is tuning in as well. Nice to see you. Mark Stewart is also tuning. Sam Curtis, you're up early this morning, mate. Are you not working today in Brighton? Nice to see you there, Sam, tuning in as well. Chris O'Gorman, Raff Reg, buddy, tuning in. Melina Thompson is watching. Al Parks up there in sunny Catterick. Even when it's raining, it's still sunny. Al Parks is watching as well. Nice to have you looking in, buddy. Paula Catterton is looking. Dennis down at Michaelo's restaurant looking in again. Nice to see you checking in, Dennis, how things are going. I bet you're holding your head in worry with what's happening at the moment with your business. I wouldn't want to be running a business at this time with all the uncertainty that is going on. But anyway, nice to have you looking in. I'm looking forward to when you do open as well, mate, as well. We'll be down for a meal. Anyway, Alan Woodhouse is watching as well. Nice to see you looking in. Gemma Harvey is also watching as well. Nice to have you tuning in as well. Karen Bush is tuning in. Nice to see you checking up as well, my lovely. Dawn Horsworth is also tuning in. Oh, Whiskey and Scam. The two lovely dogs he used to have. He used to live here years ago. But nice to see you looking in as well. Amanda Gregory up the hill is watching. The Weather Girl. Have you put the weather report in yet? I shall flick down and find out. So Amanda's looking in. She says, hi. Mark Billingham is watching. The old poacher. Nice to have you looking in there, Mark. Raff Reg, buddy. And Steve Hinklin is looking in as well. Nice to see you there. And Amanda says, this is the Weather Girl's report. A little windy today. Maybe rain later. Yeah, I think so. We were contemplating whether to go on the scooter down to the police station today. But I think we're going in the car, that is for sure. Anyway, Susie Angus is watching. Nice to have you tuning in, Susie, one of the entertainment girls on the island here. Nice to see you. Susan Waldron is also watching. George at the Obelix restaurant is tuning in as well. Nice to have you checking up as well, buddy. Chris Neal is also tuning in as well. Nice to see you. Alan Short, Raffridge buddy, looking in as well. And that's it. Right, so today's then. Jane and I, we're off to the police station to finish off doing our stuff with the police for the old biometric. And we'll see how long that takes to arrive. Once, if we can get our fingerprints done. We did hear reports yesterday of somebody went down to the police station, couldn't give their fingerprints because their hands were too cold, and the machine wouldn't give a reading. All right, so we shall have our hands in our pockets like being on the range. All those people from the military. Remember, the only time you're allowed to have your hands in your pockets was when you was on the range, when you were firing your weapon. You were allowed to keep your hands in your pockets to get your hands warm for firing. So anyway, Jane and I will be putting our hands in our pockets to make sure our fingers are warm so that we can obviously get our fingerprints done. What else have I got to say? Yes, and I also, hopefully tomorrow, finally, I will get my other laptop back ready to produce shows for the week. Don't forget, tomorrow, Wednesday, my first live broadcast of the week from here. Requests and inspiration. Pop down your requests below. And basically, don't forget the Golden Vault. You've got a special event you're celebrating. I'll pull out the #1 record of that year. And also, jukebox memories. I've not done one of them in a while. Is there a jukebox you remember in your past somewhere? You used to hear a particular tune that used to take you back. Tell me what the jukebox was, where it was, and also tell me the tune that you can remember. If you can remember the make of the jukebox, even better. That would be interesting. And also, just to let you know, Beats Radio, I've got 2 shows now going there. I'm going to be doing a Northern Soul show on Beats Radio, as well as my Anthems, Friday night Anthems show as well. And the second of that will be broadcast this week. And at the moment, exciting times in the way of broadcasting for me, just getting us through everything that's going on here on the island with the lockdown. We are still in lockdown at the moment until maybe at least the 1st of February, but I'll believe that when I see it. But yeah, anyway, that's it from me. I'm burbing on. Things to do. Big shout out to Andy Spencer, Raffridge buddy, Phil Ellis as well, Raffridge buddy. Big shouts to you guys as well. I hope you have a good day wherever you are. And you as well. Have a good day. Enjoy yourselves. And don't work too hard now, all right? I'll catch you later. Ta-ra.